Hello, welcome to the show today. Today we have Dr. Fred Schmidt from Houston Graduate School of Theology. Today we're going to be talking about the Houston Faith and Health Summit that's coming up this April. How you doing, Dr. Schmidt?
Fine, how you doing?
All right.
Good.
Well, since we have limited time, why don't we start off with your work experience?
Okay. All right. I don't know a time when I wasn't working, so I have to be more particular where I start. But let me just say, as it relates to the Texas Faith and Health Summit, this is a part of a 30-year journey, starting in 1989, I believe it was, when I was working on my graduate degree, or PhD at Emory in Atlanta. I also worked with the Southern Christian Leadership Conference under Joseph Lowry, the Stop the Killing campaign. In addition to that, I became the director or editor for the Pan Methodist Coalition on Alcohol and Drug Abuse in Nashville, where we developed a curriculum on how faith communities can impact their communities, address the issues of rampant drug at that time. It was crack cocaine,
Yes.
As well as the violence that came with it. And folks had lost a sense of hope. And so what we thought, and it was the United Methodist, the AME Zion, the CME, came together and said what we really need is a revival of hope. And so we created that curriculum, and all over the country, folks came together and began to mobilize around that issue. But once the curriculum was finished and it was out and published and we had coalitions going, I went back to Atlanta to Emory University to finish my PhD degree. I finished all my exams and my coursework. I hadn't written my dissertation yet. So I needed a job when I went back. And at that time, President Carter, this was in 1990, 91, 92, President Carter had lost, and they were just establishing the Carter Library in Atlanta. And they needed a research associate, and I was a PhD student at the time. And we had compiled a database of 2,000 congregations around the country, from first AME, in Los Angeles, to Glide Memorial, in San Francisco, to St. John's here, and a number of places around the country that who were interested in doing this because they thought it was the right thing to do. It was something that they were called by Jesus Christ in their commitment to God to impact their community, especially with this terrible plague that was going on in our communities. And that began what's called the Interfaith Health Program, where I became first research associate, but then soon became the associate director of that program, under directorship of Dr. Bill Fagey, who is now a consultant, chief consultant to the Bill and Melinda Gates Foundation. At that time, he had just stepped down from being the head of the CDC, and Carter made him the president of the New Carter Center.
Okay.
And one of the things he was most known for was he and his teams in Africa and other places had eliminated smallpox. That was a rapid disease, and now it was gone. It was based on his work in communities, epidemiology they called it, and tracking and working in communities. And one of the key sources that was used in other places, including the United States, was the people of faith. In fact, in Africa, it was no separation between faith and health. It was all the same kinds of things. But in any case, we had begun in the United States to talk about what's called the Healthy People 2000 goals. What are the goals for the nation, to bring people healthy? And at the Carter Center, we began to talk about, well, that is good for the general public, but what about the poor? What about those who don't have access to health care? What about those who live in communities, where there's not doctors, or there's not clinics, or there's not a tradition or culture even, of living a healthy lifestyle? And so the first thing came to his mind, President Carter being a Sunday school teacher, Southern Baptist Sunday school teacher, and him being the child of Lutheran missionaries who overseas, said, well, that's the faith community. And so we started what's called the Interfaith Health Program, which I became a part of. And in the Interfaith Health Program, we were trying to find ways in which faith communities could join together at that time with public health, to find ways in which to improve the health community through prevention, or what is now called upstream intervention.
Yes. Yes.
We used to tell the story about, a man going down the river, by the river, and these bodies kept floating by, and he would come by and start pulling folks out the river. Then more people were pulling folks out the river. One time, he got the idea, well, why are so many people falling in the river? So he walked back up the stream, upstream, and found that there was a hole in the bridge, and folks kept falling in the hole. Now, don't ask me why they kept falling in the hole, but that's what happened. So he decided if we fix the hole, folks will stop falling in the river.
Yeah.
Now, as long as folks fall in the river, you got to pull them out. But if you fix the hole, you lessen the number of folks in the river. Right. So that was prevention. Right. And we thought the faith community was one of those places where that could happen. To make a long story short, because I know we're short on time, is that we wound up creating what's called the Memphis Model, with 600 congregations partnering with hospital systems to address this upstream. Then went to North Carolina, and really, hundreds of hospitals, we can't number them, are working together throughout the state. And so when I came to Texas, I was able to get a position with Houston Graduate School of Theology, and I said, well, this needs to happen here too. So that's what this summit is all about.
Wow, that's awesome. Can you give us a brief preview of your educational background?
My background? Well, I went to high school in Oakland, California, called McClimate's High School. Those of you know who Yates is, similar to that. It was an all-black school in the middle of West Oakland. It was lost its accreditation, just about it. Wound up going to Harvard from there, which was a miracle of God. A miracle of God. And from there, I studied economics. That's when I first came here to Houston, right after that time. And then from
what year was that?
This was in 1974. I graduated from Harvard in 1973.
Okay.
And I married my sweetheart from Wellesley, here in Houston, and had a child, and that didn't work out, but got called to the ministry. Went to Perkins School of Theology in SMU, and from there decided that the guy that called me to teach, and I went to Emory in Atlanta. I got a PhD in what's called practical theology. I'm a religious educator. That's
awesome. Now let's talk about the summit. Now.
Okay.
What are your goals for the Houston Faith and Health Summit?
Well, let me just tell you, the goal is simple. The goal is nothing less than transforming a failed health system, a health system that depends on people being sick in order to make money. They call it fee for service. A health system that's given us some of the poorest outcomes in the industrialized world, even though we're spending more money many times over than anybody else. And so we're looking at bringing together faith communities, public health, and hospital systems to work together on something that's called population health. That is community health, and address health equity. And that is reasons why some people live in poor community, poor housing, has poor access to health care, food deserts, poor education system. All those things contribute to the epidemic of chronic disease and health in this country. Wow. And that's what we want to address.
Okay. And what are some of your objectives?
Well, we have several objectives. The first objective is to develop and deepen the collaboration between healthcare systems, public health departments, and congregations and faith-based organizations. A second is to develop what's called a peer learning action network. And that is other faith communities and other hospitals working together within a community but around the state to help one another to do what they're trying to do better, to do what's right better for their communities. And so this network would be a peer education. Mm-hmm. We also want to be able to uplift what we call bright spots, and that is where things are working. We want other folks to know that it is possible to do it, so that they might be able to do it. So we want to build collaborations. And so ultimately, we want to lift up the good things that faith communities are already doing, and because they're doing so much, but most folks don't know about it. I get tired of hearing folks saying the church ain't doing nothing. That is a bald-faced, excuse my language, lie. The church is doing a lot. It's just that we don't get to publicity about it. We don't try to put it. We do it because we were called to do it. And so we're oftentimes overlooked when these initiatives come out and people want to deal with diabetes and cancer. They come to the faith community for volunteers maybe, or use the space, or to put out their program, but they don't understand the innate power that's in the spirit of the people in those faith communities and their ability to not only impact a person's personal life, but impact the community around it.
Plus, we would like to see a collective
Yes.
effort.
Yes. Well, we call it a collective impact.
Yes.
Okay.
Yes.
What that means is a couple organizations: Houston Graduate School of Theology, which I'm a part of, one of the leading seminaries here in the country, in the state, along with It's Time Texas, are forming a collaboration, so that we can network all these different efforts around the country and communicate with them so they can know what somebody's doing in Austin, somebody's doing in Wake Forest, or in Beaumont, who are trying to do the same things and help one another. But also when there's things we can work on together, like legislations or policy changes, that we can have a collective voice, that people can hear and understand. And when there are resources to be distributed, we have a place to do it, to distribute in the places that actually makes a difference and to measure that difference.
Yes. Let's talk about some of the sponsors. What are some
Okay,
of the sponsors?
well, we have a number of important partners. One of them is It's Time Texas. They're probably our biggest supporter, and that's our partner in this. Another very important one is the Willow Meadows Baptist Church. That's where we're actually holding the conference, and they've really given over their almost their entire complex, to accommodate us. Another is 100 Million Healthier Lives, and that is the Institute for Healthcare Improvement. It's a national organization whose goal is to improve 100 million healthier lives by the year 2020. And we are part of that coalition, and they're sponsors. I'm the head of something called the Communities of Spirit Hub, which are these kinds of the Memphis Model, the Alameda County Care Alliance, FACT, and San Bernardino, who have come together to form a national peer learning action network that we want to establish a state one here. Another one is the Methodist Healthcare Ministries out of San Antonio, that has hundreds of community-based nurses and clinics. And this is a faith-based organization, who is geared towards mobilizing the community. The Texas United Methodist Conference, a mission committee, is important. MD Anderson Hospital is a supporter and working very closely with us to put on this. The Harris County Public Health, is an important partner to that. There are numerous partners. I can't name them all, right now.
Because you just got back from Austin.
Yeah, I just got back from Austin with speaking with the St. David Foundation out of Austin, Texas, that are interested in Williams County and those counties in the north. And I've met with a group of pastors and others there who are going to be a part of it, as well.
Well, tell us as we come to our close, what is the outcome you would like to see from this?
The outcome I'd like to see,
summit?
the main outcome I'd like to see is the faith community. Well, here's the outcome here. And let me just close with this. This is by Will Fagan, my director. Is it not possible to dream of thousands of congregations that see health as seamless whole, physical, mental, social, and spiritual, that see poverty, illiteracy, and addiction, and prejudice, and pollution, and violence, and hopelessness, and fatalism, and conflict, and brokenness as disease that requires the redemptive force that offered by the faith community? I want to see 1,000 congregations in Texas networked that can see wholeness, health as wholeness, and address these issues as one body, as a united body. And then I'm not just talking about Christian churches. I'm talking about Muslim churches and synagogues and Catholics and Baha'i and any folks who have in their hearts.
So this is an interfaith effort.
It's interfaith effort. It's not just Christians. It's interfaith. It's ecumenical. It's the people who are known by, who call on something that is greater than themselves and live for something, a cause greater than themselves.
Finally, tell us about the beloved community.
The beloved community. The occasion of this is the 50th anniversary of the assassination of Dr. Martin Luther King, whose goal was to save the soul of America and to create the beloved community. And the goal of the theme is the beloved community of health. And as I close, let me just read one statement. Only in the beloved community can we have a healthy community. Population health and health equity require the universal love ethic, or shalom, which is the essence of God's intentions for creation. Faith and health movement is about shalomalization, the global spread of shalom, and the creation of the beloved community.
I'm Archie Sutton, your host. Thanks, Dr. Fred Smith, for being with us today.
You're welcome.
And we want to see you at the Faith and Health Summit